Hi everybody. This is the video that I was talking about that I'm going to do for the chapters for ICD-10. I'm going to walk through the purple boxes starting on page 561 in your ICD-10 coding manual, walking through how to code for specific diagnoses and diseases. Okay, we're going to start with the first purple box in chapter 6, which is going to be the G codes. And the scenario is a hemiplegia affecting left side of the ambidextrous patient. You code first for hemiplegia, unspecified, affected left dominant side. And I want you to look at the information above that, which states how to code for dominant, non-dominant. So for an ambidextrous patient, the default should be dominant. If the left is affected, the default is non-dominant. And if the right side is affected, the default is dominant. Okay, second one, right spastic hemiplegia, unknown whether patient is right or left-handed. This would be that non-specific, so this would be a spastic hemiplegia affecting right dominant side. Okay, since the unknown is whether the patient is right or left-handed, it is automatically stated that they're right-handed and would be dominant. Okay, next one we're going into is pain management. So this box says elderly patient with back pain is admitted for outpatient chiroplasty for age-related osteopathic compression fracture of the vertebrae T3. And you would code for age-related osteoporosis first, and to age-related with current pathological fracture of the vertebrae, initial encounter. So you would have the A on the back side. The explanation is no code is assigned for pain as it is an inherited problem of the condition of which is the osteoporosis. Okay. Next one, patient presents for a steroid injection in the right elbow due to chronic pain associated with primary degenerative joint disease. First, we do the pain other, which is going to be the G89.29, chronic pain. And then we do the osteoarthritis primary right elbow. Okay. Next box, patient is seen to evaluate chronic right knee pain. Our diagnosis is pain in right knee, followed by chronic pain. Explanation, no underlying condition has been determined yet, so the pain would be a reason for the visit. The M25 pain code in this instance does not fully describe the condition as it does not represent that the pain is chronic. So there's no mention or anything that you can do for the chronic condition, so you have to do chronic pain with it. The G89 chronic pain code is assigned to provide specificity. Next one, management of acute traumatic left shoulder pain. Okay, so we've got acute pain due to trauma, okay? And then our second code is going to be pain on the left shoulder, all right? So with this one explanation, the reason for the encounter is to manage the control of the pain, okay? And then not to treat or evaluate our underlying condition. The G89 pain code is assigned first, but the instance does not fully describe the condition, so you have to add the pain in the shoulder, okay, and the left side. Next, tests are performed to investigate the source of the patient's chronic epigastric abdominal pain. So the pain is epigastric, that's going to be your first code, followed by other chronic pain because it doesn't state the chronic, okay? Pain pump dose is increased for patients' unexpected extreme pain post-thoracotomy. And this one is acute post-thoracotomy pain. So pain down to post-thoracotomy acute, okay? Then neoplasm-related pain, we've got patient referred today for pain management due to acute pain related to malignancy of the right breast. So first we have neoplasm-related pain and acute and chronic or non-essential modifiers. And then we tack on the cancer. So it would be malignant neoplasm, unspecified site of the right female breast. Okay, next one. Patient with lung cancer presents with acute hip pain and is evaluated and found to have iliac bone metastasis. Okay, so this is a secondary pain for neoplasm. That's what you're going to code first of a bone. And then you're going to code the malignant neoplasm, unspecified part of unspecified bronchus along, and that's going to be your primary column. And then you're going to do neoplasm-related pain, acute, chronic as the last code. Explanation: the reason for the encounter was to evaluate and diagnose of the bone metastasis, whose code would be assigned as first listed, followed by the code for the primary neoplasm, and then the pain due to iliac bone metastasis. Okay, so next we're moving on to chapter 7. That will be, the first page will be in your green section, color-coded, page 583 in my book. And this chapter is on disease of the eye and adnexa. First scenario, bilateral mild stage primary open angle glaucoma. And you're just going to be looking for that glaucoma, primary open angle, bilateral mild stage. Okay, bilateral open angle glaucoma, let's try that again. Bilateral open angle glaucoma, severe stage, non-specified as type. And you're coding this with glaucoma, unspecified open angle, severe stage. The explanation is, in this scenario, the patient has glaucoma of the same type and stage of both eyes, but there is no code specifically for the bilateral glaucoma. Only one code is assigned with the appropriate 7th character for this stage. Next one, bilateral chronic angle closure glaucoma. Right eye is documented in mild stage and left eye as moderate stage, which means that we're going to have 2 codes. Glaucoma again, angle closure, chronic in the right eye, mild stage, and then glaucoma, angular closure, chronic, left eye, moderate stage. Okay, next one. Documentation relates mild unspecified primary angle closure glaucoma of the left eye with mild unspecified open angle glaucoma of the right eye. All right, with this one, you're first going to code glaucoma, primary angle closure, unspecified with a mild stage, and then you're going to code unspecified open angle glaucoma mild stage as your secondary code. All right, next. Bilateral open angle glaucoma not specified as the type. The right eye is documented to be mild stage and the left eye is being as moderate stage. Again, glaucoma, open angle, unspecified, mild stage, followed by open angle glaucoma, unspecified, moderate stage. Patient's assessment indicates moderate impaired low vision in the left eye with no visual impairment in the right eye. So you're only coding for the left. Unspecified visual loss, left eye, normal vision loss, right eye. Normal vision, right eye. It's going to be basically one code. Okay, and that's it for chapter 7. So we're going to move on to chapter 8 now. Chapter 8 guidelines. It looks like there isn't any for disease of the ears and mastoids, so that's good. So we're going to move on to chapter 9. 9 does have guidelines. It's on page 633 is what I have in my book, and this is the disease of the circulatory system. The first scenario is patient is treated for a left heart failure. Patient also has a history of hypertension and managed by medication. First diagnosis is going to be the failure heart hypertensive disease. Second diagnosis is going to be that left ventricular failure unspecified. Okay, explanation: without a diagnostic statement to the contrary, hypertension and heart failure has an assumed causal relationship and a combination code should be used. An additional code to identify the type of her failure, I-50, should be provided also. So we're going now into hypertensive chronic kidney disease area. Patient admitted with stage 4 chronic kidney disease due to polycystic kidney disease. Patient is also on medication for hypertension. So first we have chronic kidney disease of the stage 4 disease, kidney down to chronic, stage 4, and it's going to be your N code, followed by polycystic kidney, unspecified for your Q code, and then finally hypertension essential primary, the I-10 code. Okay, moving on, next one, hypertensive heart and chronic kidney disease. we've got scenario hypertensive heart and kidney disease with congestive heart failure and stage 2 chronic kidney disease. First, you want to pull out the hypertension with the chronic heart, with the chronic kidney disease, with heart failure stage 1 through stage 4 chronic kidney disease or unspecified chronic kidney disease. Second would be your heart failure unspecified with the I50.9 code, and then followed by the chronic kidney disease stage 2 mild. Okay, next section is 4 hypertensive cerebrovascular disease, rupture of a cerebral aneurysm caused by malignant hypertension. So here we want to look at hemorrhage, non-traumatic subarachnoid, unspecified intracranial artery, followed by hypertension code of I-10. Secondary hypertension, we've got the scenario renal vascular hypertension due to renal artery atherosclerosis. First, we want to do the hypertension renal vascular, the I-15 code, followed by atherosclerosis of the renal artery, the I-70 code. All right, next section is atherosclerotic coronary artery disease and angina. Example is patient is being seen for spastic angina pectoris. She is also has documentation history of progressive coronary artery disease of the native artery. And you're going to just be coding the atherosclerotic heart disease of the native coronary artery, and you're going to drill down to with angina pectoris with documented spasms. Next one, embolotic cerebral infarction of the right middle cerebral artery that occurred during hip replacement surgery. The surgeon documented as due to the surgery. So we are going to be looking at cerebral infarction, intraoperative during surgery is going to be your first code, followed by cerebral infarction due to an embolism of the right cerebral artery. And the last one, and this is the STEMI issue. Acute inferior subendocardial myocardial infarction and STEMI. Non-ST elevation and STEMI myocardial infarction is how you code it. And AMI documents as subendocardial or non-transmural is coded as such, I-21.4, I-22.2. even if the site infarction is specified. In this case, we're using the non-ST elevated and STEMI myocardial infarction is the I-21.4. Okay, moving on to the next chapter, we have chapter 10, which is disease of the respiratory system. The first section that we have actual scenarios in is the chronic obstructive pulmonary COPD and asthma. Scenario is acute streptococcal bronchitis with acute exacerbation of COPD. All right, so we're going to code the bronchitis first due to streptococcus because that's what we're treating. Second, we're going to code for the COPD, acute with respiratory infection. And then we're going to do COPD with acute exacerbation. There is no code that gives us the inclusive chronic obstructive pulmonary disease respiratory infection with exacerbation in it, so we have to code it separately. Okay, second scenario, exacerbation of moderate persistent asthma with status asthmaticus. Okay, we're going to go to the asthma section with moderate persistent with status asthmaticus. Acute respiratory failure as a principal diagnosis. Our scenario is acute hypoxic respiratory failure due to exacerbation of chronic obstructive bronchitis. So we are going to do respiratory failure first with hypoxia, followed by chronic obstructive pulmonary disease with acute exacerbation. We're leaving off the bronchitis because the bronchitis is inclusive with the exacerbation and with the COPD. Okay, reading the explanation here, it says category J96, which would be the respiratory failure section, will combination codes that designate the severity of the presence of the hypoxia and hypercapnia. J96.01 is a sequence as the first listed diagnosis for reason of encounter. Respiratory failure may be assigned as a principal diagnosis when it is the condition established after study to be chiefly responsible for the occasioning the encounter and the selection of supported by the alpha index. So if by chance that the respiratory failure was indeed what they were treating with nothing else, then that would obviously go first. But in this case, it does go first because we're doing the COPD exacerbation second, because the respiratory hypoxia is the main code. Next one, acute respiratory failure due to accidental oxycodone overdose. So obviously we're gonna have a T code here, going into drug and chemicals, going over to oxycodone, and then we're doing the accidental column. This is an initial encounter, so you want to make sure you get all your 7 characters on that. Follow it up with, you're going to look for respiratory failure, acute, and it's unspecified whether it has hypoxia and hypercapnia. Next scenario, patient presents with acute pneumococcal pneumonia and acute respiratory failure. Acute respiratory failure goes first, and again, not specified as hypoxia or hypercapnia, and the second diagnosis would be pneumonia due to Streptococcus pneumoniae. We got one more in this section. Okay. Scenario: influenza due to avian influenza virus with pneumonia. Influenza due to identified novel influenza A virus with pneumonia is what you're coding for. Okay, so that's the end of that chapter. So we're going to move on to, my next color is the purple, chapter 11. And it looks like there's nothing there for guidelines there. So we're moving on to 12. And this will be the last one I'm doing for this video. And then I'll do 12 through the rest on the next one. All right, so chapter 12, disease of the skin. First scenario is on pressure ulcers. Stage 3 pressure ulcer, left ankle, 6 by 7 centimeters, that invades the fascia. Stage 2 pressure ulcer of left hip. So we got 2 ulcers going here. We got to put the stages on that. The first one is a stage 3, so that is of the ankle, pressure ulcer, left ankle, stage 3. And then we've got pressure ulcer of the hip, stage 2. Next one, unstageable pressure ulcers. Pressure ulcer of the right lower back, documented as unstable due to the presence of a thick eschar covering the ulcer. So we were looking at pressure ulcer. So ulcer pressure, it's on the right lower back and it's unstageable. So there's only one code. Documented pressure ulcer stage. So we got left heel pressure ulcer with partial thickness skin loss involving dermis. So we got the pressure ulcer again down to left heel, stage 2. Okay, code assignment for the pressure ulcer stage should be guided by either the clinical documentation of the stage or documentation of the terms found in the alpha index. The clinical documentation describes the left heel pressure ulcer, partial thickness skin loss involving the dermis. Matches the ICD-10 index parathernical description of stage 2, abrasion, blister, partial thickness skin loss involving epidermis and dermis. Okay, so in the code set that you're looking at, make sure you look at the box to indicate if they do not tell you the stage, but they do tell you the layer of the skin, you can actually detect what code it is for stage based on the layer. Okay, next one, patient receiving follow-up examination of a completely healed pressure ulcer of the foot. So if it's completely healed, we're doing an encounter. So encounter for follow-up exam, and this has to do with a malignant neoplasm, with a condition other than a malignant neoplasm, and then you're going to follow it up with a personal history of skin and subcutaneous tissue. So it's going to be a history code, and that'll be, they're both Z codes for that one. Okay, so I'm going to stop here, and that gets us through 6 through 12, and the next video will be starting with chapter 13.